Look at that kakapupu disc. It'll also let me know what's disc and what's nerve, because everything is a nerve until proven otherwise, and everything is white otherwise. Pulling out all the stops, check out this view, and then check out navigation. So that's the upper limit of the bone work. Oh yes, if I just keep going straight in, that's exactly where the stenosis is, there and below. And then to get to the other side, I have to go over the top. And look at that, look at the left lower hand corner. I'm starting on this side, I'm going all the way over to the other side. It's a straight shot, I feel like a cheater. Now I just need to get a little bit south here. The stenosis goes from here to there. You can even see that little cloud of calcified tissue there. I'm gonna get that real good. So check out how yellow this ligament is, and hence the Greeks call this ligamentum flavum, or yellow ligament. It's because it's really yellow. It's unbelievably thick, and it's the main cause of your stenosis, by the way. That little red thing means that's the canal. So I'm just debulking it now, and then I'm gonna laser it thin, much more thin, and then I'm gonna resect it using what's called a kerosene punch. There's the canal with the dural tube surrounded by epidural tissue. And check out this little fleck of bone that's poking inside here. Check out this little spike of bone. It's pointy. Oh, yes. And there's the dural tube, that bluish thing right down there. So I'm going to make sure everything is free. And you can already see down here, it's already got enough room. It's floating. I just got to get rid of all this other stuff. But this is the hard part right here. Look at that sucker pulsating. It's kind of creepy, but I love it. So check this out. If you want to see what a dural tube looks like, look at that thing. And this happens every time we do the decompression. It starts bleeding because there's no more tourniquet. And I'm just going to all the way to the other side, reaching up and over. It's called the over-the-top technique. I know, totally uninventive. Look at that. So, a little bit of laser work, a little bit of hemostasis, and then I'm going to be done with this 3-4 level. And I'm very, 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 very happy so far. The dural tube is happy. It'll probably start pulsating in a second. I'll probably have to decompress the 4-5 level, which is even worse, before the pulsations, but we'll see. And one last thing, you take this big old instrument that articulates, look at that, it's like a thing you see in a construction site, a hoe, backhoe or something. Look at how it just fits all the way across, tons of room. If there's anything there, I just pull on it. Look at that. It will just articulate in there without any impediment. That's another way of saying tons of room. Okay, now I've got the laser over the top and under the lamina on the other side. It's called the over-the-top technique, but I still get such a kick out of it. It's just, can't believe you can do that so easily. It has nothing to do with me, it's just geometry. I wish people can see this, because they always like, how do you get to the other side? It's like, over the top, it's so easy. Navigation pointer, and check out with navigation. I mean, you can already tell, look at this. That's the right side, that's the left side, but if you're still questioning me, here's the navigation pointer. And that's not even down, but look at the left lower hand image. I'm all the way to the other side. Yes. And then I'm way north, way up here. Way up here, even further than that. All the way down to there. And way down here. This is where most of the stenosis is. Yep, down to the pedicle. All done on this level. Feels so good. So here's the thick ligament flavum. I've thinned it down. And then I'm using the twisty San Diego pimple popping maneuver. And look at the dural tube. Look at all those veins. Kind of scary, kind of cool, kind of exciting. There it is. Now that I decompressed both levels, guess what's happening? Lots of little epidural bleeding, but there's the dural tube. And I can pass that big articulating curette, the head of it, all up and down, left and right, in and out. I'm very happy. Surgery's all done. It went beautifully. It was a lot of work on my part though, so I just hope you have a little bit of pity on me. But the surgery went beautifully. 3 poke holes for the 2 levels, and then a poke hole for the computer navigation tracking pin. Still 3 nice little band-aids. I call these the world's most expensive band-aid. It went beautifully, and we're all praying for a great result and a speedy recovery, so best wishes.